Hi guys, welcome back. Today the topic is about the basic steps in pre-treatment planning of dental implants. Okay, I've divided this into many parts and this is part 1 that I'm going to be presenting today. Okay, so that when you make implants and I'm due for implants, I'll be happy, hopefully. Let's see. So what are these implants? Okay. These are inert substances that are introduced into the soft and the hard tissue used for cosmetic and functional purposes. Alright, can either be in the soft tissue through the mucosa or into the hard tissue into the bone, and it provides support to hang on to, hold on to the prostheses that are there. Obviously, any kind of prosthesis, it can be a removable prosthesis or a fixed prosthesis. Okay, anything that is going to be used to help in aiding occlusion in chewing, that is replacing the tissues, is a prosthesis that is given intraorally when you're looking at the oral aspect. Okay, if it is fixed, okay, that can be completely fixed or it could be flexible. There are different ways of doing that. Today we're only talking about the fixed prosthesis. Okay, how do you go about planning them? When were these done first and how it goes on? Okay, history dates back to 3000 years ago when the first copper stud was seen in Egyptian mouth. And in Europe, the Roman soldiers had these iron dental implants. There's a small story that says earlier on, they were taking these teeth, the original teeth, okay, from normal people, from the slaves, and then using those teeth to build prostheses for the high class people. Okay, that's how it started. Remember, dentistry was in the hands of the barbers, okay, and slowly we modified, then the medicos started, and then it went on, and finally we are here. Okay, that's a different, it's a big story in itself, okay, right. So the first time that anybody talked about dental implant is about Raaonline. Okay. So this gentleman, okay, Raaonline, he recently passed away. Amazing personality, and he was the person who talked about how that was an accidental finding that he made, how titanium made cylinders, okay, that he had used got integrated to the bone and he was not able to remove them from the long bones. Okay, and henceforth he defined osseointegration and he brought about these implants in the orthopedic field, and from there on we copied it onto the dental field as well. Okay, so that is Professor Raaonline for you. Remember him. He's done a lot of work in this field. All right. Now, dental transplantation happened as early as 17th century. Now we are talking about in the 20th century, we're talking about more of, we're in the next century now, yeah. So now we're talking about more of subperiosteal implants, other types of implants that are there that get osseointegrated to bone, okay. When you look at osseointegration definition per se that was given by Raaonline, what he suggested was whenever you put titanium in direct contact to the living tissue, bone tissue, okay, he says they two form a permanent biological adhesion, and he named this phenomenon osseointegration. The bone gets integrated